So let's start with our female hormone replacement. Specifically, let's start with the premenopausal female. So women who have not yet hit menopause, but there's a lot that's going on during this time as well. So when you think about the menstrual cycle, it's complicated. I mean, there's a lot of balancing and a lot of nuances that have to take place. To kind of do a quick summary, the female cycle starts, let's start during the onset of menses. So at this time, hormones are at one of the lowest levels. Estrogen and progesterone are very, very low. Estrogen starts to kind of increase during this next 2 weeks, which we call the follicular phase. It starts to increase and then it really peaks at around the time of ovulation. Afterward, estrogen takes a little bit of a dip, but it still remains pretty high. However, progesterone, let's talk about that. So progesterone stays really low during the first 2 weeks, during that follicular phase. After ovulation, now there is a follicle in the ovary that is producing progesterone. And ideally, that is the time the progesterone really increases. It should take off at this time. What we're finding in a lot of premenopausal women, and there's a term, it's called estrogen dominance. I mean, it's not anything that you're going to see used in by a traditional endocrinologist or OBGYN, but it is something that kind of describes this relative stage or relative state where we have extra or too much estrogen in relation to progesterone. So again, it doesn't necessarily mean that you have too much estrogen, but it's all about balance. So here we are again talking about the importance of balance during the in the whole hormone symphony basically. So what happens if you do not have enough progesterone or progesterone declines? Well, first of all, there's studies that show the average American woman progesterone is going to decline by 80% by the age of 40. So that's a lot. So what are some of the symptoms? So I'm going to use my little cheat sheet here as well, so don't forget anything. But there's some really common symptoms we find with estrogen dominance, meaning not enough progesterone. So big ones are PMS, which is that irritability and that real intense anxiety, the PMS symptoms prior to menopause. Another one is actually an increase in menstrual headaches and migraines. Definitely some other symptoms are, worsening fibrocystic breast disease. So your fibrocystic breasts the symptoms are going to get worse, more painful, more uncomfortable prior to the onset of your next period. There's also going to be issues with weight gain, and especially around the hip area, and fluid retention. And also, you're going to see increase in menstrual cramps, and it's also a risk factor for uterine fibroids. So these are just some of the symptoms of having not enough progesterone in relation to the estrogen. So we call it estrogen dominance. Again, it's very, very common nowadays in the premenopausal female and the average female by the age of 40. So there are things that we can do to improve this, and we will go through that, and we'll also kind of talk about why is this happening? Why is there a deficiency in progesterone? That part is going to, I'll talk about that in more detail when we go into the adrenals, mostly because there's a lot of issues that happen with stress. Stress is like the most common thing that I think we deal with. It's the 20th and 21st century disease, I guess we can call it, because it affects so much of what's happening in our hormonal system. The chemical messengers are not working as adequately. They're not ideal, they're not optimal, and they're not in balance due to stress-related phenomenon. So we'll go into that a little bit more in the adrenal section, but definitely what we know is that stress is a big part in this estrogen dominance issue. We see a lot more in premenopausal women.